I said fireside chat kind of thing. It's already pretty late in the evening, so we would request the both the dignitaries here to talk for a few minutes, and then after that, we would leave it to the audience to ask the questions. Ajit, unless you want to ask them some questions.
Sir, for me personally, it's been a great honor to be associated in whatever small way, and to be a big fan of this. I've been a very big fan of this institution ever since I've come to Hyderabad. And you may not remember that one of my first visits from that campus was here. And in that time, 2003, to see the kind of work that was happening on agri-tech and sensors, etc., was to me mind-blowing. And I think, as we were talking yesterday, that we will hopefully take this institution to a level where you will always be even prouder than you are today. Thank you. So no, all that I wanted to, this is a tremendous opportunity to meet two people who have been involved at very big grassroots level. And I'm not going to put any difficult question, but I'll start with more on the public health part. So you can't pass the baton on that. So now you've written a number of articles, wonderful articles. It's just stepping back. If you have to, because I'm looking at this as technology in society, right? There will be other challenges that will come. There may be newer things. Based on what we have learned, what according to you, and this is the same question in a slightly different way to you, if we had the full freedom, what do you envisage as, because people came together, research started. See, even for when we started Rich, it was the same thing, right? We want to take research from the research institutions to market. That's what happened. Oxford did it, universities in US did it, companies took it over here, governments worked together, etc. So what is it that we should be doing and be prepared for as a community to deal with future health issues? And then I'll also leave it to you. Similarly, the industry came out very quickly with the rejigging products, with continuously manufacturing. What do they need? Because one of the big things we are talking about is lack of data, lack of public data. You have written on so many times. Similarly, these regulation, etc. I think for all of us as a society, this is the time to use this time to ensure that the next whatever shocks we get are nowhere as bad. So I'll just stop there and I'll leave you to.
Well, you have touched the whole area of the relevance of research and the purpose of research. In terms of public health, and I'm sure in terms of other areas where we apply science, the purpose of research is to generate evidence-informed, context-relevant, resource-optimizing, culturally compatible, and equity-promoting recommendations for policy and practice. And for that, we require multidisciplinary research. And that research has to definitely, as very appropriate to the theme of this conference, has to be problem solving and barrier breaking in order to advance societal well-being. I've always believed that science is sterile if it lacks a social purpose. At the same time, policies and programs must stand on the strong foundation of robust science, otherwise they'll crumble on clay feet. Therefore, we have to definitely ensure that science is steered in that direction. But again, recognizing that most problems of society, particularly in the current times, are complex and relate to many complex adaptive systems interacting with each other. You have to necessarily bring in multidisciplinarity. Far too often, we have strayed into linear pathways of research and tried to find very siloed approaches which offer limited solutions. And I believe a campus like this can actually bring together people from multiple disciplines. And more importantly, the academic complexes of the Twin Cities can actually bring in that kind of a coalescence of multiple disciplines to address real world problems and find the right kind of solution. And public health is definitely a very important priority area for that kind of research. And where technologies can help greatly is in advancing the whole agenda of universal health coverage, making health available, accessible, affordable, and provide appropriate care with the right kind of quality filters as well. And therefore, technologies can actually help us overcome a large number of problems, but we do need to focus on the right questions to ask because the solutions are all there. It is the questions that need to be discovered.
So, thank you. I was sitting in the audience and listening to all the speakers before me, and I learned a lot. I was really inspired by the various topics being discussed and how technology can play a role, how technology can create solutions at scale. And I'm going back with a lot more than I came in with, and I'm really inspired by the work all of you have done. And it opened up a lot of possibilities in my own mind about how we could make a difference. Having said that, I think, in spite of the phenomenal strengths we have as a country, medical professionals, lowest cost products in the world, pharmaceutical industry, producing products which serve countries from China to the US to Russia, anywhere else in the world, and then finding that we can't supply a multivitamin pill and to the people who need is really depressing for me. So this is where I find that a partnership with technology to enable the capabilities to the places where they are needed and the economics to get them there all exist, and technology can play that role. And somehow if we can marry technology with the capabilities in medicine, in manufacturing and capitalism, all of these, if they can come together in partnership with governments, I think we can find solutions and roll them out at scale. We've shown that. I think we talked, speaker before me talked about Aadhaar and digital health mission and all of these things. And somehow if we can connect them to physical services and solutions, I think we can make a huge impact. And no country in the world has talked about digital infrastructure the way India has done at scale. UPI is a good example. Aadhaar is another great example. I find that I think the possibilities of using technology as a force multiplier to ensure the solutions reach the poorest of the poor in the most remote areas in this country is possible. And that's the message I'm taking away from all these conversations. How can companies like us take the products to where they're needed? And the role of companies is also evolving. In the earlier Milton Friedman mantra about the profit is the motive for every business is moving now. I think companies are becoming more purpose-driven. They're using capitalism as a force for good, finding solutions for problems, and actually playing an important role in society. So I think combining all these things, building partnerships with academic institutions, with government, only government can, get to the scale that we really need. I think there is an enormous opportunity here for us as a country to lead in this whole process.
I have one question. What are the one or two areas that the center should focus on in your own thinking?
Professor Reddy has very clearly outlined the kind of problems that really require attention in order to ensure that our human resources have the opportunity to develop the full potential. And I would say that public health and primary care, which are actually conjoined twins, should be the area that you should be focusing on. Just even to talk about universal health coverage, since I mentioned it, UHC is supposed to operate in 3 dimensions. One is population coverage, second is service coverage, third is cost coverage. Population coverage is how many people in the population does this program serve? Service coverage is what are the components of the services provided in the package? Third, of course, is cost coverage. How are you reducing out-of-pocket expenditure, catastrophic health expenditure, healthcare-related poverty. Now, the primary care actually addresses all the three best. In terms of population coverage, it is universal because everybody requires some kind of primary care service sometime or more often, many times in life. From normal delivery to vaccination to anything you take it. In terms of service coverage, it has the largest package of services because it covers many common conditions. And it is also the most resource optimizing cost saving type, not only because it is actually providing cost in terms of relatively simple interventions, but also because it is preventing the advancement to serious disease, which is going to be resource intensive and technology intensive at a later stage. So I would say that that is where you ought to be focusing on substantially. And the marriage of health and education is absolutely critical because they are absolutely so codependent. If you don't have good health, you can't really access good education and reap the benefits of that. And if you do not have good education, you are unable to really access health information with which you can protect your own health. And you cannot even actually get the kind of occupation and income which will generate the money for you to seek health care when you fall ill. So both of them are actually go hand in hand together, and they need to be really looked at as a very important conjoint area. And that is where, again, in primary health care, from health promotion to disease prevention to early detection, we can play a huge role. And it's very important for us to recognize that, as Professor Reddy has said, if people are not well nourished, children, they have visual impairment, hearing impairment, many other challenges that they have, they will not benefit even from the opportunities that are being offered to them. It is not enough to talk about equality of opportunity. We have to talk about equality of circumstances. Not enough to have an open road. We need to have an equal start. And for that, you need to correct a number of other societal factors, starting with education, but using educational institutions as an opportunity to correct other elements of disadvantage. And there, I think health and education can really work very closely together. And we ought to really work in that area and advance universal health coverage from that level upwards.
So I just want to build on what you said. I think I don't want to repeat it, but I think what I feel is that the center can really bring together and create an ecosystem of both technology to reach where the healthcare services are needed, as well as education, and also partner with private sector companies and government. Because I think when you put all this together, the scale and the impact will be much more powerful. I'd also want to add that primary healthcare, we already have a lot of physical infrastructure. The primary health centers, we have ASHA workers in every village. How can you build that partnership with technology and with standardization and with partnerships with the private sector and government to really create a good impact? And the same parallel can be used even in schools and academic institutions. How we can use, I'm using technology as a information technology. How we can use the power of technology to become a force multiplier in creating this impact both in health and education, and also bring the partners like private sector partners who can use the digital infrastructure and create impact across the country. I think it's a very powerful idea of marrying technology with physical infrastructure, partnership with government to create population level impact. And
I would add to that. We normally think in terms of technology as an enabler in the area of health service delivery, in terms of enhancing availability, affordability, access, quality. But there is an additional dimension. It empowers people. Right now, there is a huge asymmetry of information and decision making between the doctor who holds all the information and the poor patient who hardly has that information. Technology can really provide that kind of a level playing field, if not completely, at least substantially, by providing a tremendous amount of information to the person who is seeking healthcare, so that they can exercise a far greater level of autonomy in decision making, they and their families together. And they actually will be able to decide also on what kind of public health policies in the community also can be really steered to enhance community health, public health. So in a sense, you can use technology also to democratize the health system.
And education too.
Thank you.
Obviously also, these startups are now making it, I mean, you started, I don't even remember how many years ago, the tablet, right? It was a bit ahead of its time, but today, with the kind of technology we have and the startups who have now come in to plug the gap, LV Prasad has that phoropter, with one phoropter every costs 100 rupees or 200 rupees. Every school can have it. And every village, therefore, in the evening, you do it for people. So I think, there is now an enormous opportunity. And what this is going to do is actually bring it all together. Because as you rightly said, we are still working in silos, right? And I have to do my contribution as it is rich, which is what we are supposed to do, is to bring. We'll be more than happy to partner fully to empower this center to, bring all those stakeholders together. So I think that is perhaps the way ahead. But I must also make one last comment. I love that Jugalbandi, how they each one added on each other. And that there is, I was just going to say, let's just step back and let them go. Thank you.
We would like to leave it to the audience if you have any questions to our distinguished guests here.
Hi, I am Manish Ranjan from Nano Health. Hello, everyone. So I had a question about who pays for primary care. So because I think there's enough data, we suppose that we, ourselves are definitely not ready to pay for our own health, at least in the primary care in the preventive form. So, who should be paying for it? Or who should be, yeah.
Virtually all countries who have really advanced their health systems to provide good universal health coverage, which is strongly focused on primary health care. But of course, we cannot only talk about primary health care. Primary health care is the foundational basis. Comprehensive, continuous, chronic plus acute, but also connected health, primary health care, connected to different levels of health care bidirectionally. But that kind of care has to be provided by predominantly a tax-funded system. If you look at most countries, that's where it's happening. If you look at the NHS in UK, about 84% of the total health expenditure is government expenditure. Similarly, Thailand and Japan and others, even the United States of America, which is the poster child of privatized medical care, 48% is government expenditure. Therefore, but it doesn't mean that care has to be delivered only by the public sector. The public sector has to be the guarantor of service provision. NHS, the primary care physicians are all private. They're all contracted into the system with defined deliverables and accountability mechanisms. So the question is, we have to definitely ensure that there is a higher level of public financing, supplemented in our present circumstances with employer-provided insurance, privately purchased insurance, etc. We will, and it's never overnight. It's a progressive effort, but it has to be there. But virtually all health economists in the world have clearly come to the consensus that unless there is a substantial amount of public financing, you cannot achieve universal health coverage, including primary care.
I completely endorse what you're saying, but at the same time, I think if you look at the costs in India, primary care is not very expensive. It's among the lowest in the world, anywhere in the world. So to that extent, I don't know if the government should subsidize everybody. I think right now the government does provide for the below poverty line free care. It probably needs to be strengthened, and somehow we can draw the private sector into this ecosystem. The quality of care would be probably better. But for you and me, I think primary care is not a huge cost. It's very low in India, and I don't think we need to. The government has many priorities, and of course, the allocation to health is increasing every year. But it will be a long time before they can take it to the level of NHS or the US. And in the interim, I think we can all pay for ourselves through insurance, through various systems. But the government is doing a lot already, and I think it's in the right direction today.
The one question I'll just come to you. There's one question from the online attendees. What resource needs are needed to be fulfilled to bring about digital transformation of health in India? What resources are needed to bring about digital transformation of health in India? The related question in some ways, but
so this is a question best answered by, I think, Srinath. This is what kind of resources would be required. But the cost of this is not that great. We have seen in the case of other digital platforms that we have seen, which connect people to needs and resources to where they are needed. But certainly, I think Srini is a better person to talk about cost of resources than me.
the source of resources, where can we get the resources from?
So I think number one, there is already a move towards creating a health identity. And I think that is going to be extremely critical. Just like UPI and Aadhaar transform, that health ID is going to transform our ability to deliver digital health. And I think we should never underestimate the enormous change that will happen. Because what it will also force, it will force the public health delivery system to digitize. Today, the entire hospital chains are still work on manual system. So you have no data, you have no ability to understand, where is dengue, for example, which part of them, who are suffering what. That is going to be the one big, and I don't think that cost of that. So it will require digitization of offices and infra, which is great. It will also release, make it efficient. That's number one. Also, by the way, it will, what is happening today is people write the symptoms and people write the medicines, and nobody writes in between what. So I think there are many physical, but those are the real constraints. Second is making the data, anonymized data, available. And this is where I think we as a center will have, if we make that data, we have the same problem during COVID, right? Unless we know what the data is, unless we can quickly analyze it. The third part of that is a costly part, where we'll have to create biobanks, because if you're going to do long-term research, and especially personalized medicine is going to, we as a state, my dream at least, is for us as a state to be the pioneer in personalized medicine, going 10, 15, 20 years. So the analysis that is going to be required, the genetic evaluation, those are the costly ones. And I think I don't think we have a solution yet, but hopefully there will be other people who will create a center in these things.
Can you repeat the question again? The digital resources. Yeah. Okay. It's in multiple things here. One is the government of India is actually willing to help us if we come up with a good plans there. And we have the philanthropy organization like Dr. Reddy's Labs, so also they're also willing to do it in Intel and all of that. And we have the institutions like this where much of the infrastructure and all of them comes more or less free to us. A combination of these things that having centers focusing on different delivery platforms could actually bring in something which is basically an open source following the standards that all of us develop, just like the Aadhaar or UPI kind of thing. So that's a way to go in my mind. I personally feel that if we show the success of it, there are lots of people out there, both the philanthropy and the other foundations and the government. I think all of them will come together to help. So far, the institutions like us have not taken up those jobs. It's just the companies, they just come up and just do some wrapping and say that we keep saying these unicorns that they're coming up there. But our wish is that healthcare, fine, there are some people who will make a business out of it, nothing wrong about it. But I think it has to be very open and accessible to all the people. We should not build barriers for the technologies that will come out of it. Now, our dream here in Triple IT is that to build that large scale primary healthcare platform. That's our dream. And I think we will find the resources. I'm not very concerned about it. I have GV Prasad just 2 steps away from me.
Yeah, I mean, let me add a little to that. When you ask a question about what resources are required, how big is your canvas? What's your ambition? It depends upon what you're attempting to do. Are you taking the moonshot, or are you trying to find an immediate solution for an immediately visible problem? That actually will tell what your resources are going to be. For example, we have had auxiliary nurse midwives in Himachal Pradesh trained with handheld devices, with point of care diagnostics and decision support systems, detect and manage diabetes and hypertension. With over 18 months, we had 15 millimeter systolic blood pressure reduction and 50 milligrams % blood sugar reduction. Now, that doesn't cost much. The question is, how are you investing and how are you actually utilizing the system? On the other hand, for personalized medicine, yes, you could do very many things, and you probably we do need to do that. But again, it depends on how sophisticated you want to get. Simple genetics may not be enough. We have hundreds of trillions of bacteria sitting in our gut microbiome. Their genes and our genes act in concert. There is a metagenome and there is a super phenotype, not only by our physique, but also our social environmental circumstances. So how much of big data you want to gather? But it needs to be done sometime. It needs to be undertaken by institutions so that ultimately you will be able to find out what the causal pathways are, what are the potential points of intervention are, and ultimately you may be able to come out to a simple proteomics or a metabolomics where you will be able to make your diagnosis and then say, okay, this is the intervention. So you have the big ambition certainly, but approach the immediate problems which can have a maximum, a huge impact. So I would say your triple IT should be what? Interesting, innovative, impactful technologies.
So I think the other thing that we should think about is standard setting, platforms, other catalyzing mechanisms, which Mr. Ajay Mishra spoke about, how we can create impact. The government has a great role in this, in catalyzing these innovations and creating public infrastructure for companies to innovate and everybody to follow certain standards. That would make a big difference. And we have great examples in the India Stack, the UPI, all of those. So we can use a similar model for health also, especially primary care. And that will dramatically, create innovative solutions at scale.
Maybe there is one more, if I can add to that. What is happening, and take education as a classic case. I think Byju's, when they originally started, were meant to be for ordinary people. Then the private equity gets into it, all kinds of valuations happen, and the whole thing gets. Now, can we create a fund of a few philanthropists which is meant to reward, and not ridiculously reward, but reward? And to me, we change the definition of unicorn as something that helps 100 million people. Unicorn is not $1 billion thing. And for them, we give a reasonable, these are not people who are wanting, frankly, if you get 100 crores, an average human being has got to say, what do I do with it, right? These are people who are driven. What we need to produce is people who are driven by purpose and not by money. That is our role. But when they do, we must find a way of rewarding them somewhat. so that there is enough number of people. But I know, I mean, people like Manish, etc., have given up their lives, but then what do they get at the end?
This is very laudable, but I have to tell you that the power of capitalism is so immense that we have to depend on that to find solutions and spread them at scale. Philanthropy can only catalyze, but to be truly sustainable, you have to have the power of capitalism behind the various things that we are trying to do. I think.
A truly scalable model.
Yes.
Can be supported through a profit, for profit, scalable model. There's a question here, please. Go ahead.
I thought Sir was saying something. So thank you. Good evening, everybody. I'm Ankita. We're talking about healthcare, and as somebody who's a representative from mental health care field, I am very, very curious coming to this platform about technology and society, that what can be done to fill that gap of mental health care and AI tech integration. Because as a psychologist, I've gone to interiors of different states and seen that the only way people are getting to know about mental health is at the stage when they're extremely unwell. So tertiary care is when they come to the healthcare centers. I've gone to colleges, that's also when they come to the mental health care service, tertiary care. So what can we do to integrate tech and probably, the keywords which we had today, accessible, barrier-free, culture-free, have primary intervention for mental health care through technology across India? So just my curiosity, if we could talk about that.
I think I'll defer to Dr. Srinath Reddy about this, but from my perspective, every disease in India has the same challenge. People directly go to tertiary care. They don't go through screening. They don't go through primary care. And this is a problem in every disease. For example, you take cancer. Most of the cases we get are in stage 3, not in early stages where the early detection can really help. Having said that, I think if you see the Western world, digital therapeutics are getting very popular, especially in diseases which are addiction related or mental health related. And there are some interesting solutions, but I'm not sure that will deal with all the challenges that you're talking about. And probably Srinath Reddy would be the better person to answer this question.
Well, I'm not sure I'm the better person, because actually on Saturday and Sunday, I think there is a big workshop being organized by the Ministry of Health on the whole area of digital applications for mental health. After the budget speech, where the whole idea of mental telehealth centers 23 have been announced. That is one way of trying to provide support for people who are seeking help. Certainly it helps, but it doesn't necessarily extend to people who are not digitally quite savvy. And secondly, also, it doesn't necessarily penetrate very much into the smaller towns and villages. We'll have to overcome that through proper primary care setup. But there are a number of ways in which there are potential applications possible. I mean, if you really look at the global literature, you're far more familiar with it than I am. People even pick up basically on monitoring, depending upon the number of calls people are making, whether they're getting into a depression or not, if they're getting into social withdrawal or not. So all of those became early signs that can be picked up. I mean, apart from providing services to mental health and suicide prevention and trying to help people who are being bullied, those are all obvious things that are there where you can reach services. But in terms of actually even tracking the mental health progression, there are a number of possibilities that come in. And we ought to really find out how best we can adapt to our circumstances and see how we can actually provide that. And again, in primary care, there is a great potential for frontline health workers to play that role if they're technology enabled.
Some work happening with NIMHANS. Some of our professors are working with researchers at NIMHANS, trying to create some of these models. They're looking at some of the more advanced disease conditions like dementia and such. But hopefully, I think we can extend that work to also screening and such. So we'll take one last question. Incidentally, I was going to refer to Dr. Satish because they're doing some work around children's mental health. And we'll have Satish have the last question. Dr. Satish.
It's more of an answer or a semi-answer to the question that she asked. I'm Dr. Satish. I'm a pediatric intensivist and I run the Choice Foundation. And we have picked up 7 problems from the pediatric perspective in the rural health. So we have already done 10,350 children from 4 South Indian states. And the 7 verticals are, one of the most important thing is psychology, the growth, anthropometry, height, weight, head circumference. That's the second. The third is we do BERA and the OAE, that's the hearing health of the children, and the vision, including refraction, and so on and so forth, total 7. So just to your question, so with psychology, in fact, in 2015, the American Academy of Pediatrics said that more than 30 to 40% of children, every third child in the US has a problem, and the pediatricians have missed it. So that's your problem. And the pediatricians have missed it because they've been regularly coming for vaccinations and they completely have missed the psychological problems in these children. So 1 in every third, that's a very big number. So in 2016, we started this project. Last 5 years, you know what SDQ is, SDQ, that's a non-common thing. So we picked up the questionnaire and we worked on the questionnaire along with detecting autism and ADHD and all the various disorders. There are about 13 or 14 of them. And we use this questionnaire. The problem is, see, what's the 1/3 of the population is pediatrics, right? Now, can we screen everybody? It's impossible. Can we sort of physically have a psychologist go and examine everybody? No. So what we have done is technology again. How did we do that? First, we want to screen all the 100% population. If my system, if my software, if my questionnaire can sieve through the problem and a majority of these children are sorted out, at least I have the resources to see or the problem children. So what do I do here is I pick up the at-risk children. So my questionnaire, what it does, it depending on the age, less than 5, 5 to 12, 12 to 16, they have 3 people answering the questionnaire. Number 1, the teacher of the child, the parent of the child, and if the child is more than 12 years, the child also answers the questions. Based on this questionnaire, there are about 45 to 50 questions. My tool makes out whether the child is at risk or not. Now, if the child is at risk, then only my psychologist needs to actually attend. So this is already done in 10,350 children, and we are able to pick up who are the children who needs to be identified, because see, we hardly have 2,000 psychologists in the country, if I'm not mistaken, right? But the population is huge. So if we can run this sort of this email questionnaire, and we have developed a tool where the software automatically automates the response. That means the software guides us and tells us there are 8.5 lakh responses, and my system tells me, yes, this child is at risk. This child needs 1, 2, 3, 4. That means this child needs a developmental screening test, autism screening tool, MChat for autism or ADHD, and the other 75 to 80% of the children who are normal, they are sieved through and said, these children don't need the psychology detailed counseling or a detailed assessment by the psychologist. So my aim is, if I can perfect the system, which we are already doing, but make it more scalable. I was just talking to Professor on this aspect. If we can make it more scalable across the country, and now, as I said, we have 10,300, and if we can do maybe 10 lakhs or 20 lakhs, 30 lakhs, we can perfect it even more, and we don't need to worry about those 70% of the children who are seemingly normal. And so we need to worry only about this small population, where what we do now is we work with those children, try to identify our exact thing, then we have to do the detailed assessments. We can't help it. And those children, we can get them into the therapy. So that's one aspect, one of the 7 that we do, apart from the other things. I hope I...
Thank you, doctor. I think
just one other element is that actually there is a tremendous amount of inhibition in people seeking mental health care because of the worry about stigma. technology can actually provide you a way of that. If you can reach out directly without necessarily being identified by others as a person having a mental health issue, I wouldn't say problem, but issue, then that will encourage many more people to seek care with the confidence that that's not going to be a problem.
No, absolutely, sir. I think we're working with Choice Foundation. We'll see how we can let technology kind of enable some of this. So, Srini, sir, last words. Thank you.
I think everybody is waiting to to wind up the day. The comments from here, it's been a very wonderful, day from the morning. It started around noon with various panelists talking various subjects, kind of thing. For me personally, it's been a very, learning. We think that we know so many things, but you come to these kind of places and you know that you know so little, because so much is happening across the board. So many people are doing such a great work in many areas of healthcare, education, livelihood, kind of thing. It's a great learning for us. Now we have quite a few problems out there who people, various organizations have outlined, and we'll take up quite a few of them, but we also want to take up probably one or two large problems. And next year when we meet again in the annual conference, hopefully we'll come back with a lot of positive news by then. And we seek the involvement of most of you. This is all about network effect, team effort, kind of thing. And this is a public institution, and we want the contribution of time, money, whatever is possible from various people. And we really want to address the issues of this nation going forward. Thank you all for attending this conference.